Having a rhinoplasty practice, we hear a lot of patients express a lot of concern about, do they have to have their bones broken, and when do we have to do osteotomies?
The idea of having bones broken is a really scary idea for people, but in truth it's a very controlled procedure, and when done right it's something that really leads to very little swelling and significant bruising.
Yeah, most patients are really concerned because when they think about osteotomies or breaking the bone, they really think about an arm or a leg, and they're used to that as a concept for a broken bone. When in reality, when you really look at sort of an example of a skull, what you see is the nasal bone itself is really thin. It's like a nail. So what's really important to understand is what you're really doing is making a very controlled cut from inside, where you're cutting along the base and you're basically pushing the bone in a little bit. It's a very controlled procedure, and when it's done right, it really should not lead to any significant bruising or bleeding.
Now, not every single procedure requires an osteotomy. There are a few main reasons in rhinoplasty where we'd use them. One is when someone's crooked. If they've broken their nose, or their nose might have always been crooked, we need osteotomies to be able to bring the bones and shift them back over to the midline to straighten them.
The other significant time is if you have a relatively big bump, when you bring that bump down, it's going to be important to close that roof up again. Again, if we go back to the skull, if we imagine that right now when we look at a certain person that the bridge width across the top is here, if we have to file that down significantly, you can imagine the lower we go, the wider that nasal base would become, and as a result we have to do that osteotomy to close that top up and again get back to a normal width across the bridge.
And there are also patients who have wide bones to begin with. They may not have a big bump that we're bringing down, but their bones are just naturally too wide for their nose and their face, and we want to do osteotomies to narrow and give a little more definition to the bridge line.
So the main point here is don't be afraid of the osteotomy. When it's necessary, and it really shouldn't significantly impact the downtime or the amount of bruising that you have.